Okay, hi everyone. I can unmute now. Eileen, good morning. Try and unmute, okay?
Morning.
Good morning.
Okay.
Thank you for joining us from. So I've just put everyone, good morning, everyone. I've just put in the chat room for everyone to tell us where you're joining from. Let's make it, just drop where you're joining from. We're making this interactive today, and I'm just trying to admit people, sorry. Okay. Chat in the room. Where are you joining from? Let's meet you. Okay, Ghana. Thank you. The UK from Jos. I used to love that. Well, I still love that city. I lived in Jos for a few months. I lived in Jos for a few months and it was always raining. Thank you. I'm trying to turn this. Okay, we're waiting for others to tell us where they're joining from. Lagos. Canada. What's the time over there, Ellen?
6 o'clock, 6 a.m.
6 a.m.
Yeah, just
Wow.
after.
Thank you so much. You should be on your bed. Okay. Let's see. I already said we'll start in 3 minutes, but let me see. What's the time right now? Okay. Let's start the introduction. But before we go ahead, just in the chat room as well, how are you feeling today? 10 out of 10. Are you feeling like 10 this morning, just now? Chat in the room how you feel today. I don't know. Let me check. How am I feeling today? I think I'm excited. I don't know. I'm tired and excited at the same time. So I'll just say I'm like an 8, maybe. Okay. Let's know how you're feeling. You bring in the vibes to this webinar, and I know everyone has left everything they're supposed to be doing now, and they're right here. We all are going to be learning today from one another. So, some people are in the waiting room. Okay. Okay, I'm not seeing this flowing. Just 2 people have told us how they're feeling today before we start the meeting. Okay, 10 over 10 is good. That's interesting. I'm sure in the next 10 minutes, I'll be feeling 10 over 10. Let's see how that goes. Okay, who else is telling us how they feel today? Don't forget we're making this interactive. Okay, so can we get to it today, this morning? We have, please, are you ready? Are we all ready? The team in Lagos, are you ready, please? Yeah, thank you. I'm also hoping for the best. Everyone's hoping for the best. Okay, can we start, please? Uh, we're introducing to you, Elaine. But before we go ahead, I want to say a big thank you to everyone that has registered and of course that is joining this meeting and that has shared this post. This is very important. I kind of did a survey and I, I was with a group of parents and I was asking like a lot of questions about how the journey has been. And one interesting thing about raising a child with Down syndrome is that just like um, everyone says that it takes a village, to raise a child. It's not just going to be about you, the mother, the father. It's going to be about people around the child, people the child, you know, get comes in contact with are going to be having like their own different experiences raising that child. And then I was asking parents, what are like the major challenges you're kind of like experiencing at the moment? And quite a lot said speech, quite all right. Um, Again, one of the one of the challenges that tops the chart was behavior. So I quickly checked my contact and I remember Ellen. I met Ellen in South Africa, I think it was 2019, and she lives in the US. So I reached out to Ellen. Ellen, we need you on this. Can you do this for us? And of course, she said yes. So if you're still listening and you're in the room, just type a yes if you can hear me and if you're ready to go. So just type go, 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 go. Just say go, 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 go. And that means we are ready to go. So 3, 2, 1. If you're ready for us to start, I'm going to bring Ellen right to you now. And I want you to just say go, go, go. If you're ready, go. Let me see go. How many goes am I saying? Go, 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 everyone. Thank you, everyone. And I know Ellen is ready for us as well. I think 6 a.m. in the US is about 12 o'clock, 12 noon in Nigeria, and 11 a.m. in the UK. So I want to thank everyone from joining, even from Canada. I don't know what time it is, but now we've got the goals. Now let's go straight to what we have today. Thank you. So Ellen is on. Go ahead.
Okay, you want me to start, right? I'm just going to share my presentation. Thank you so, so much for having me. Um, like Tola said, today is going to be interactive. So if you have any questions, you can type them in the question or in the chat box. And whoopsie, hold on. What happened? And we will try our best to answer as much as we can. I'm not an expert. What I am is I'm a parent, and I've worked for Down Syndrome South Africa for the last year and a bit. But prior to that, I worked at Down Syndrome Association of Pretoria. I have a 17-year-old son who happens to have Down syndrome. So, as a parent, I've had to learn as I go, as all of us do. And I always try to make sure that I have as much information as possible to share with other parents because I work for an association. So, if there are questions, we'll do whatever we can to answer. If we don't know, we'll go look for the answer and I'll share it with Tola. But again, thank you so much for having me. And let's get started. We're going to be speaking on teen talk, the most wonderful time of a parent's life, right? Okay. So what is the goal for your child, for your teen, right? We want our children to be as independent as possible, and this is any child, right? We want them to be as independent as possible in their work, in their personal care, in their social life. We want them to have good self-esteem, to have friends, to have an active social life outside of school, sports clubs, friend get-togethers. We want them to be active and valued. We want them to be an active and valued member of society and in their community and work. And we want them to be ready to work, to have good communication and understanding, and to have at least the basics of functional reading. That is what we would like as parents, right? Those are our goals. So it to get there, we have to work hard, and so do our children, right? So to have an actual active social life outside of school, that includes sports clubs, friends get-togethers, to be active and valued, to be ready to work, to have good communication and understanding of at least, sorry, hold on. So adolescence. So the start of adolescence can be a source of concerns for parents and caregivers as their children approach the stage of development. It is a time that's overwhelming, and especially as we have a child with Down syndrome or an intellectual disability, it is a time of uncertainty, right? So accepting that our children is that our child, well, is transitioning into adulthood, it can be challenging, but it's crucial to ensure that your child is adequately prepared for the physical and emotional transformations that accompany puberty, right? So what does that mean? So first we need to know, do children with Down syndrome go through puberty too? So as parents, we don't want to face the facts that our kids grow up. I always joke with my kids, no, you're not growing up. You can stay 5 or 11 forever. But the reality is we can't stop our children from growing. And the reality is that children with Down syndrome do grow the same as every other child, right? Um, so we have to face the fact that our kids grow, mature, and start having, those feelings, the feelings that make us uncomfortable. And then children with Down syndrome go through the same body changes and emotions as everyone else. They can struggle with these changes and feelings that they start having, because it's not easy for typical children to understand the emotions that they are going through. It's even harder for a person with an intellectual disability to have to navigate this time in their lives. So parents of children with Down syndrome, we can experience heightened concerns due to the unique challenges our children have. And some children might even have related health issues. Most young people, regardless of their background, share common anxieties about the changes that adolescence brings, leading both parents and youths to wonder how they will navigate this period. Come on. Okay, so some myths and facts to look at. So myths are persons with Down syndrome are oversexual. Persons with Down syndrome, these are the myths. Persons with Down syndrome do not experience the same feelings as typical children or typical people, and persons with Down syndrome are eternal children. So the facts are persons with Down syndrome are not oversexual. They just need guidance. They have the same feelings and have the same sexual needs as everyone else. We just need to guide them to appropriate behavior and to understand what is inappropriate behavior. Persons with Down syndrome have the same, okay, persons with Down syndrome grow and become adults and have the same adult feelings, wants, and needs. So it's very important that we shift our mind from they are eternal children, that they are oversexual, or that they don't have the same feelings, to the reality that they are a human being, they have human feelings, they just need support to navigate those feelings and emotions. So oftentimes, like I said earlier, the parents have these concerns. We worry about what is my child how is my child going to manage this? How is my child going to get through all of these challenges? How am I going to get through these challenges? So, our fears, will my child manage puberty? Well, my child won't manage her period. That's a common one that we get. My child is self-stimulating at home. My child is self-stimulating in school. My child is not self-stimulating. They are scratching. That is oftentimes a something that parents say because they don't want to see that their child does enjoy self-stimulation. I will not let my child self-stimulate. My child is angry all the time. My child is showing aggressive behaviors. So I want you to think for a minute, what are things that you worry about with your child? What what are your fears? What are you anxious about? Right? You can put those in the chat. All right, so today we're going to look at body changes, private versus public spaces. So body changes are different types, the different changes that will take place in your child. For girls, being comfortable with her period and changing her pad. Private versus public spaces. Where is public and where is private? Private versus public on the body. Private versus public behavior. Consent. Now, this is a big one because it's not something that we actively think about. We know that someone has to say yes or someone has to say no, right? But it's not actively thought about that. It's something that we have to teach. So what does it mean? Appropriate and inappropriate behaviors, appropriate and inappropriate touches. Okay, so what happens during puberty? So for the boys, we have the physical changes. So they have a growth spurt. Now, I know our children um, uh, can be and are shorter than the typical general population. However, their body still changes. And they still have some growth spurts. Their body mass starts increasing, facial hair growth, deepening of the voice, all of this happens to our children. Underarm and pubic hair growth, enlargement of the genitals, and then the first ejaculation, right? So that begins between 11 and 14 years. And that can be incredibly scary or overwhelming for a parent to realize that this is happening to an 11-year-old, right? It is incredibly overwhelming. And it's much easier to just want to not have to face it. But if we don't face it, there can be much bigger challenges later on, right? So emotional changes are mood swings, being more sensitive, feeling self-conscious and about physical changes, and feeling differently about peers, right? For the girls, physical changes include also growth spurts, breast development, underarm and pubic hair growth, their first period, presence of vaginal discharge, and increase in fat mass, right? So they then start becoming a woman. So for many parents of girls with Down syndrome, the fact that their daughter will get their period is daunting. And I've heard this over and over and over again. Well, I've seen it over and over and over again as well, especially in groups where parents are incredibly worried about how their child will manage the period. So you may wonder, how will she manage? Can she change her own pad? Will she be able to have good hygiene? And the reality is, with visual supports, with empowering your daughter, physically showing her will empower her, and with being informed, she'll be just fine. So I'm going to tell you a story. There was one of my colleagues that I've known for years. She's one of my colleagues. She's got a daughter with Down syndrome, and when every time when she went to the bathroom, and the mom had her menstruation, she would take her daughter with and show her all naturally how to change the pad, where to get the pad, how to throw it away, and she would show her over and over and over again. And eventually, the one day her daughter got her period. And what did she do? She went, she got her pad, she went to the bathroom, she put it on, she cleaned herself up, and she was fine, right? And since that day, she's been managing her period. So physically showing her will empower her, making it a natural order of events, letting them know that this is natural. It happens to everyone, has nothing to be embarrassed about or scared of. That makes all the difference. With being informed, she will be just fine. So this is a video. I don't know. Okay, so I'm going to show you a little bit of this. Hold on, I need to share sound. I'm so sorry. I'm going to show you a little bit of this video because it's eight minutes long, but I'm going to share it with Tola to share with everyone who signed up, right? Because this is something that was done in the 70s, but it's with a little girl with Down syndrome. But it just shows just how repetition and visual supports actually do help our children to learn.
Nesta. Mom.
Yes, honey?
You know we were talking yesterday?
Yes, we were.
Do you know about periods?
Yes, what about periods?
Do you have periods?
Yes, all women have periods.
Tell me what happens.
Blood from inside of my body comes outside from an opening between my legs. Do you have a question, Jill?
Yes, I want to know if Susie has periods.
Susie? Yes, Mom? Jill wants to know something. What do you want, Jill?
Susie, do you have periods?
Do I have periods? Jill, all women have periods about every 4 weeks for 3 or 4 days. When I'm on my period, blood from inside of my body comes outside from an opening between my legs.
Well, Susie, what about my teacher? Does Miss Jones have periods?
Yes, Jill, your teacher, Mrs. Jones, does have periods. All women have periods about every 4 weeks for 3 or 4 days.
Hi, girls.
Hi, Dad.
What have you girls been talking about?
About periods, Daddy. Dad, can I ask you something?
Sure, honey. What is it?
Does Aunt Curl have periods?
Yes, Jill. All women have periods about every 4 weeks.
But, Dad, men don't have periods, do they?
That's right, honey. Men do not. Only women. Blood from inside a woman's body comes outside from an opening between her legs about every 4 weeks.
But the blood, won't it get on my clothes?
No, it won't, because you use a sanitary
A
pad.
sanitary pad.
Yes, a sanitary pad.
Susie, what's a sanitary pad?
Come on, Jill, I'll show you. I'm having my period now. Let's go into the bathroom. This is a sanitary pad. This is where I keep them.
Blue, white, blue, white. Look, it is blue on one side, white on the other.
That's right. It also has sticky stuff, like glue on the blue side. See?
It's sticky.
Do you know why it's sticky?
No.
Sticky so the pad will stick to my panties.
How do you use it?
I'm having my period now. I'll show you how I use it.
You mean the blood's coming from inside your body now?
Yes, from the opening between my legs. This is a used sanitary pad.
Look, there's blood on it.
See? That's right. Blood coming from inside my body through an opening between my legs. With the pad this much blood on it, it's a good time to change it. I'll show you how I
All right, so I'm going to go to the next
change
one,
it.
but this is
Watch carefully.
this can be shared with everyone, because it's something that is so helpful to show your child over and over and over again and helps them to understand. Then visual supports about getting my period also help, right? So we have there's a fantastic site or organization called Advocate Health. Well, no, Adult Down Syndrome Center, and then their website is Advocate Health. Anyway, so they do tons of visual supports, and this is just one of them. Speaking about growing up, about getting their period, and it is so helpful because it is visually helping our children to see what the changes are going to be, what they need to do, and so on and so forth. So knowledge is empowering, and it's something that is so hard for parents to do, is to share this information with their child. It's because it's hard to talk about these things. It's hard to talk about growing up. It's hard to talk about puberty, the things that happen during puberty. It's hard to talk about sexual feelings. So it is absolutely not the easiest thing to do. However, it is so important to have these open discussions with our children in age-appropriate ways, right? So empowering your teenager with Down syndrome begins with providing them with essential information. Equipping your teenager with knowledge is a powerful tool. It enables them to understand the changes happening to their bodies, including aspects like erections and their effects, what is appropriate and inappropriate, and this fosters self-awareness and confidence, supporting the overall development. So equipping your teenager with information will also help them to have a better understanding of good and bad touches so that they can keep safe, right? So here we have they may not like a bad touch and a good touch. See here, hands are the only ones. Using visuals to show them, okay, well, this is fine, you can touch on the hand, the rest, anything else, you should actually ask permission, or it shouldn't be done. Okay, so private versus public spaces. Persons with Down syndrome are strong visual learners. And using visuals to help explain these concepts, it will help your teen with Down syndrome to better understand private versus public. And so why is this? Because oftentimes there are things that persons with Down syndrome don't necessarily understand automatically. Like for typical people, it will come naturally. Okay, well, if I want to scratch my backside, it's not something that I should do in public, right? But for persons with Down syndrome, they've got to scratch, they want to itch. They've got to itch, they want to scratch, right? It's the same with, why is persons with Down syndrome, or why do sometimes boys end up self-stimulating in class? Because they need to be taught that it needs to be done behind closed doors, right? So private, this is again a nice, fantastic visual that shows, okay, what is private? What do we do? How do we identify what is private and what is public? And so we've got these two options, or these two visuals to show, okay, public is when there's more than one person, private is only one person, when it's you alone, right? When you're getting dressed, when you're using the bathroom, when you're showering, if you got your hands in your pants, pick your nose, when you pass gas. Your bedroom is private, the bathroom is private. When you're getting undressed and dressed, right? So what is public? Public bathroom, that's public. Restaurant, grocery store, work, park, store. You're shaking hands with someone, high five, when you're waving, when you eat, when you dance, all of this, or when there's people around, it's all public spaces. right? So another place that has wonderful resources is downsyndrome.org.uk. They have wonderful resources that look like this. It's an easy to read format, and it explains the difference between private and public spaces. Yes, some more. So private versus public on the body. One thing that some people do say, or is anything that your bathing suit covers is completely private, right? And anything that is then shown is public. So if you're wearing a tank top or a vest, that you can wear out, that is fine to show. But anything that's covered in your by your bra and panty and underpants must not be shown in public, right? And no one must show you that. Okay, so private versus public behavior. To understand this, we need to give persons with Down syndrome clear guidelines of what is public and what is private, right? We need to consider whether we are sending confusing messages. So do we guide them on what is private and public? And do we set boundaries? So if you go to the bathroom, is your door open or closed? When do you start closing the door and not letting your child in? Because I know when our little ones are younger, they run in and out when we're in the bathroom because that's just what happens. But when do we tell them that, no, now this is private time, now you cannot come in? If you're showering or bathing, do you tell them that they cannot come in? When they are showering or bathing, do you knock first and ask if it's okay to come in? Do you get their permission, right? If you're getting dressed or changed and your child is getting older, do you get dressed in front of them? Do they get dressed in front of you? Do you ask permission to walk into their bedroom? Do we give them privacy when they need it and ask for privacy when we need it? We need to have a set rule in your house, whatever makes you feel comfortable. There's no age specific, but it could be 6, it could be 7, it could be 8, but you should be setting the boundaries to show them exactly how they should be as well. And that will be a huge support to them in learning private versus public behaviors, right? So many parents can become overwhelmed when they see when they see their child experimenting with self-pleasure, right? And it's important to note that it's all part of growing up. It helps them to understand that this is, you need to help them to understand that this is private behavior, and it's not something to be embarrassed about, right? It's something that is natural. It's part of growing up. And well, I'm not saying encourage it, I'm saying encourage them to go to the bedroom, to do it in private, not in the lounge, not at school, but let them know that it's fine. It feels fine. It feels good. That's perfectly natural, but they must do it in private, right? So consent, like I said earlier, this is something that doesn't necessarily, I know for me, the penny didn't drop that it was something that I had to teach because it comes so naturally to us, right? To understand exactly what consent is, but this is something that needs to be taught to our kids. So we need to say it means to give permission. Understanding the concept of consent is vital, right, for persons with Down syndrome, to be aware and empowered, not to be taken advantage of. Also, so that they understand the boundaries that they have. So they have boundaries for themselves, so that they're not, so they're less vulnerable, right? But also so that they know that they cannot touch someone's breasts, and they cannot touch someone's bum, and they cannot, touch someone without that person saying it is okay, right? It's important for any relationship they have, and important for everyday situations. So there's lots of again visual supports, but there's also lots of videos on YouTube. YouTube has a wealth of knowledge, a wealth of videos on there that speaks about shows about consent as well, and it is so helpful for our kids to have these visual supports. So appropriate and inappropriate touches, and this is also something that's very important. So as they get older, it's important that they, for non-family members, no more hugs, only side hugs, and only on special occasions, right? Because um, it's not necessary anymore, right? So we need to make sure that they are protected. Our children are more vulnerable. So we need to teach them, and we need to teach them about the side hug, and that you can't just run up to someone and hug them just because, right? As we get older, and you say to them, do you see the other adults around here or the other teens around here doing that? Our kids being such strong learners, such strong visual learners, and copycats, do learn from what they see as well. Another question, should your teen sit on someone's lap? Do you see other teenagers sitting on people's laps, right? Is it appropriate? Should they kiss on the lips? This is again like in the family situation, it's depends on the family dynamics, but should they be kissing other people on the lips, right? Use visuals of private and public areas on the body to help reinforce what is appropriate and what is not. So I'm going to here after this go into some areas of behavior itself. So just because it's important to have a better understanding of different behaviors also. So appropriate and inappropriate behavior. Almost all teens are awkward in social settings, and this is across the board, right? They get surly and they don't talk to adults, and they don't want to hold their parents' hands, and they don't want to talk to their parents, and their parents must drop them 2 blocks down from school or whatever it is. But teens are awkward because they're finding themselves, right? They're trying to find their identity. So in persons with Down syndrome, they can have a much harder time reading social settings. Okay, and that is very important to remember. That is why having, if you see they're struggling, help them to understand. Okay, so let's look at this. Why can individuals with Down syndrome have behavior challenges? So it's important to know that challenges with long-term memory is something that children with Down syndrome have, or persons with Down syndrome have, and repetition is key. And I'm sure many of you who are parents of a child with Down syndrome, you hear that all the time: repetition, 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 repetition. That is what is so vital for our kids, right? And many of you would have, even if you hadn't heard it, you would have, through everyday parenting, realized, okay, well, I have to repeat this over and over because they haven't reached the level of understanding and grasping what I'm teaching them yet. Repetition is key. They're visual learners. Their receptive language is much stronger than their expressive language. So oftentimes they may not be able to articulate certain things, but they have a very good understanding of what is being taught to them, what is being told to them, right? So persons with Down syndrome can understand but struggle to express their needs. And this leads to frustration. And the executive functioning, persons with Down syndrome can need up to 20 seconds to process what is being said or asked. So for example, if you want to give an instruction to a child with Down syndrome or a teen with Down syndrome, you give the instruction and you wait for them to start carrying it out, right? What happens is it reaches them, they need to process it, and then their brain tells their body, okay, well, this is what I need to do. That's why it can take up to 20 seconds for them to process and then do the actions. So persons with Down syndrome do improve in the executive functioning. However, until then, they need support, right? So as with every day, they improving, getting better. Think about when they were a baby, then they were doing therapy to be able to get to the rolling over, and then the crawling. So they get there. They just take a little bit more time. So
Sorry, Ellen, you have about 5 minutes because we don't have much time on Luma.
okay.
All
All
right.
right. So all right. I will then send the presentation on. But it's important to remember that you need to give reminders and reminders to you make sure that the work instructions are broken down into smaller steps, if it's in verbal form or in written form, needs to be broken down with visuals. They struggle with social problems solving. They want to interact and they struggle to know how. They're too social and they struggle to read cues. Very sensitive to loss or change. They do not like change. So persons with Down syndrome can tire quicker working through the day, and they can become frustrated or want to avoid tasks. Okay, so just remember that behavior is about you want to reinforce the behavior that you want to see, and you don't reinforce the behaviors that you don't want to see, right? So always keep in mind the learning profile of a person with Down syndrome. Use visuals because they're visual kinesthetic learners. They have the desire and ability to learn, and they have strengths in social understanding and relating to others. They can struggle with hearing challenges. So sometimes it's like they're hearing underwater. They have low muscle tone, and this can affect their everyday activities, and they tire easier. Doesn't mean that they cannot do things. All right, so persons with Down syndrome can take time to adjust to changes. Transitioning can be a challenge. So this is just about reward systems, positive reinforcement. They always, always, always love hearing what they're doing well. So this is a lot of this is just self-explanatory that I will share. And then if you have any questions, you can see. So just remember, why do visuals work? Because it's, or the support systems work because it's visual, it's repetition, it's motivation, and gives attention for positive behavior. You must always look at the, okay, so you must focus on the target behavior. You must observe data collection, so that because you want to see what challenges the child is giving, and you want to see why, right? The function, is it to get something or is it to avoid? Look at a replacement behavior, so redirection, interventions, reinforcement, implement plan, and then you continue the process because it's repetition, repetition. Okay, this is just an example of the two functions of behavior, which is mainly escape and for attention. Give choices. As teens, they are wanting more freedom and they're wanting more freedom and to be able to make more choices because they're becoming adults. So you want to give them choices, say first and then, or give them choices in everything that they do, right? Okay, so what do we avoid? Don't say too much too fast. Don't focus on the bad behavior. Very hard, but it's important not to focus on the bad behavior. Rather say what the behavior is that we're expected. Look, it's always good when you sit nicely in class. I am so proud of you for doing this. So what is inappropriate behavior? So in life we have rules, social rules, rules at home, rules to by laws, etc. And they apply to persons with Down syndrome. It's not like they have a separate world with separate rules. So we need to make sure that persons with Down syndrome understand the rules of behavior. what is appropriate, right? So we need to also not make excuses like they don't understand they have Down syndrome. It's just how they are. Or burying our head in the sand. My child would never do that. We need to be open-minded and realize that persons with Down syndrome have the same rules and the ability to understand. Think back to the goals of your child. What work do you need to do to help them to become the best versions of themselves that they can be? So what is inappropriate behavior? Hanging on everyone, kissing everyone in someone's personal space, talking about private parts, touching someone's private parts, wanting to be the center of attention, acting silly and being the class clown, which is something that our kids do, self-stimulating in class, public spaces. If teens are doing this, it doesn't mean that they are bad or naughty. It means we need to help them to understand what is appropriate. Okay, and then one thing that like a lot of people might have a query on is like self-talk. So what is self-talk? So a lot of time self-talk, people with Down syndrome use self-talk to talk through what they are experiencing or how they're feeling. So it's their way to process. The only time it's inappropriate is when it's done in a social setting, right? So we have to teach them it's something that they do in their room. It's also a private behavior. So we always need to move towards adult behavior, use adult words. We need to work from when they're 12, they're not 7 anymore, so we don't talk to them like a baby, right? We start moving towards teen behavior, teen language and adult language, right? Because they feel it. They absolutely do. So topics that should be discussed is different types of relationship, friendships, romantic relationships, crushes, conversation skills, rights and responsibilities. Be open to trying role playing. Talk to your son's daughter teachers about finding a way out what is being discussed in class, and then work together on this. Be proactive and not reactive. Empowering your teen will help him to have a better understanding of what changes are happening. It will help him to be aware if they are placed in a vulnerable situation, and it will help him to be socially appropriate. And he has some resources, and at the end of the day, you're going to look back and breathe a good sigh of relief and say, I did it. All right. Any questions? There we go. Over to you, Tola.
Wow, thank you so much, Jillian. That was powerful. And there's a question in the chat box that says, at what age can we introduce them to this because my 6-year-old doesn't understand?
Do you want me to answer now or afterwards?
Oh, well, I think let's get more questions coming into the chat box. If you know that you learned a lot from this from what Louis, sorry, I said Louis because someone called Louis just popped in on the screen. And so if Ellen has really kind of like said some things that really made a lot of sense to you in the chat room, just tell me how you feel. Let us know how you feel about what she said. The past 30 minutes, she's been trying to talk about, she's moved from the periods and just so many things cause behavior for our kids. So just chat to me, chat to us, chat to everyone. Let's know if we need the positive vibes in the room today. Right. Yeah, we're going to be sharing. We're going to be sharing. Ellen, I don't know. I'm going to ask her, but I'm going to share the recorded webinar with everyone. Right? And Ellen, are we okay to do that?
Yes, for sure.
Okay, thank you very much. All right, that was like very, very, very interesting. I learned like some new things from that. Thank you so much. I think I'm gonna go straight to what we have today. I think we don't have much time with Luma. I don't know. We're supposed to be 3 hours, but I think we've got 2 hours and we've just used 1 hour. I want to take some questions as well. So I think I'll go straight to what I've got today for everyone. Okay, so today I will be talking about like a buffet of behavior. So can I have the slide, please? While I was trying to prepare this slide, well, for those of you that I don't know or don't know me, this, can we expand, can we like expand the screen, the presentation, please? So I'm also a mom like Ellen, and I know we have some moms here. We've got some teachers here as well. My name is Tola, and I'm happy to meet those that don't know me. I'm sorry, I thought my screen was on all the while. So this is me, and let's go on to what we've got today. The screen is still tiny. Can we expand it, please? Maybe, is it me? Is everyone saying like 100% of the presentation, or is it me?
No, it's small.
It's small, yeah. So maybe just click present, something like that. I can try to share it. Oh, okay, thank you so much. Does this look better, everyone? So if you can see in the chat room, just say yes, yes, yes. Okay, thank you so much. So just a quick introduction, because I've started my career like when, of course, everything changed for me and I had my daughter. I started to look into early intervention, and I've done 1 or 2 programs here and there, worked with some organizations in the US, and then I have a master's in social innovation with professional practice. And then I also started to look into employability and support for children, no, so sorry, for adults with intellectual disabilities as a TSI instructor. And that is training in systematic instructions for people with disabilities to hold jobs. So that's just about me. The next slide. So I think I wanted us to like have like a brain drill. And this is it. So anyone can read can you read no, I want the first one, please. Can we read what's like if you know, sorry, not this one, the next one. Can someone type what you see, like the yellow and the pink? There's some words I've written in yellow and pink. Can you type it? I purposely blurred it. So what I've got there, in case you cannot see it, is the buzz about behavior in Down syndrome. That's what I've typed there, but purposely kind of like blurred it so that we kind of struggle to see it. And that's me letting you guys put yourself in the shoes of people with Down syndrome, people with intellectual disabilities, that, because there is always a buzz about behavior, the behaviors, but those without intellectual disabilities also have bad behaviors. And there is not much buzz about that. We just say, okay, they're just teenagers, they're going to outgrow the behavior. But we see a lot of people look at our children and talk about a lot about their behaviors, like, and that's kind of like labeling them. But it's just a part of them, it's part of who they are, just like Down syndrome is a part of who they are. So I want us to look at this appetizer, and an appetizer here is like small daily behaviors that probably we can just allow to slide. Then the main course are the bigger challenges our children with intellectual disabilities are faced with. And the dessert, I put that as something soothing, like rewarding behaviors. So this is an example, refusing to go to bed. I see that as a main course. If you're following me, can you just say yes, yes? I just want to know everyone is following me and I'm not like, just give me a thumbs up. Let me know you're listening and maybe like you're following, because I was thinking, how do I present this? Because there are some behaviors that we should worry about. There are some that we can't do anything about, because what we see here is the type of brain our children with intellectual disabilities have. We cannot say this is the way we want them to be. We can only support and guide them. And I'm saying, smiling at you when you praise them. Do we see that like as is it a proper behavior? I say yes, because it's a rewarding behavior, because you're praising them and they're smiling at you. Collection of bottle caps. Has anyone experienced this? Does your child collect like stuff? Are they fixated on stuff? Do they have stuff like, they just keep, like my daughter collects bottle caps a lot. She collects combs a lot. Uh, dolls, like she even takes people's dolls from school and brings, what else? Towels, tissue, just different things, bottles, and she lines them up. So to me, it's rewarding for her, but to me, it's a big challenge. And I put that under the main cause. So refusing to take blood samples, what do you guys think? I think it's a big challenge for our children. It's a bigger challenge for them. Let's go to the next slide. And this is just for us to think about those behaviors and kind of where do we put this behavior? Is it something I need to worry about? And that's what I mean. So a buffet of behavior, and that's takes us to the topic, understanding and managing various behaviors in Down syndrome and autism. So I said Down syndrome and autism because a lot of our children with Down syndrome, they go undiagnosed for autism. So it's not like the full-blown autism you see in children that have classic autism or that are just on the spectrum for autism. Next slide. Okay, so we've all heard, I'm not going to like say some of the things my colleague has talked about. Behavior is communication. That is very, very key. But our goal is to interpret the behavior and not react. Next slide, please. So understanding behavior in Down syndrome, what do we mean by understanding behavior in Down syndrome? People with Down syndrome are socially driven. They love routine a lot. They're visual learners. They can exhibit stubbornness. I've heard that a million times, and sometimes it's just when there's something off, like we see that behavior, like being stubborn, when their routines change all of a sudden. And apart from that, they are individuals that love to succeed. They have a strong will and nothing can shake this, nothing can change it. Nothing. So if it's from exhibiting stubbornness that they achieve their goal, then I tell you, nothing can stop them because they love success. And they also benefit from clear expectations and consistency, which you have to like, has to be like a day-to-day affair interaction with them, making your instructions clear, being consistent, engaging in reinforcements, rewards, and repetitions. Next slide, please. So that way we can understand what behavior is in Down syndrome. But when it's coexisting with autism, what are we looking at? We're looking at a greater sensory sensitivity, like they might be hypersensitive to some environments, to just different scenarios, and not be able to generalize like task, be able to locate a toilet within the house. But when they are outside of the house, they are not able to locate a toilet, then they pee on themselves or they have like accidents. You should know there's something off, like, because we expect our children to be able to communicate some of these things, even if they don't have like 100% speech. And then when they are more rigid in their thinking patterns or like the behaviors, like sometimes it looks like OCD behaviors, then with communication differences as well. Sometimes they get frustrated when they're trying to communicate and people don't understand them. And, they just have like this behavior, and sometimes they cannot find the words to describe how they're feeling. Next, please. So we're going to look at sleep patterns, transition resistance, hoarding or OCD, self-injury, emotional withdrawal or outburst. Let's go on, please. So sleep behavioral patterns, this is very common in children with Down syndrome. They love some, like, not, when I say children, I'm not saying all of them. So for most children, they have like sleep behavioral patterns, sleep issues with sleep is a very big deal. I mean, it's a big deal if your child has Down syndrome. It's something you need to keep investigating till you get to the root of it. night waking, sitting up to sleep, propping their heads down to sleep. Um, the body is telling them there's not enough oxygen going to the brain, and that's because they've got other medical conditions. And these are just the sleep behavioral patterns that you just have to report, because sometimes it's just there's just not enough oxygen taking blood to the brain. It has to do with the way, the way the anatomy of their skull, their head, the flats, all the facial, all the different facial characteristic features we see just makes things a little bit different for them, like the narrow passage around their ear tubes, behind their nose, a little bit of a flat facial bridge. And then imagine the shape of the skull. Just imagine it is different from ours. So we have all of those things, and then these things go ahead again and disturb their sleep. They're not having like that's good sleep. We have sensory overload, anxiety can cause that for them as well. And of course, the medical issues I was talking about. So strategies you can use to support them is be consistent with bedtime routine, the visual routine chart. We cannot even go wrong with this. I think that sends a quicker message to their brain, what we're trying to tell them. And the environment, of course, investigations, the medical investigations, the calming environment is very important. My daughter cannot sleep without this late light. At a point, I got tired of that light, but I guess that's what kind of calms her down. If not, she's in her room doing her self-talk until 2 a.m., 3 a.m. some days. And I think that's a very difficult period, not being able to sleep. So for the routine and transition behavior, it's difficult to, with unexpected changes that happen in their lives. This may delay or resist. They may delay or not even want to do any task like dressing, leaving the house. Sometimes they're just like tired. They don't want to do this thing. And you're saying you have to do. But I say you have to prepare them for what they're going to do. Even tomorrow, you have to prepare them for today. So like you can use like countdown timers, visual schedules, giving of choices. I think some of these things too were mentioned when Ellen was giving our talk. And so we can't go without using some of the strategies, giving of choices, visuals, and of course timers. I use the timers more often now because it just helps me instead of me talking and talking and talking. So when the timer goes off and it's 7:30, she knows it's time to take her medication. So she goes into the medication, the box, and I now go in and support. And that's the way we're looking at independence for her for the future, because I don't know how long she's going to take medication for, because that's a medication she's been on for so long. So hoarding and OCD traits as well. Of course, we'll see a lot of behaviors around hoarding. And my daughter has been hoarding like bottle caps and bottles for a long time. I would throw away all the bottles, and the next time I would trash them, and the next 24 hours the room is filled with bottles. I'm like, where did she get these bottles from? I get so upset, every time I see these bottles. And then, we started to, it's a kind of control. She feels she's in control, so it's part of what she wants to do, and that at that moment. So you stopping her from bringing out bottles or picking bottle tops, you're just interfering with, you're messing up her day already. So, withholding and OCD traits, it can be glaring that this is what it is. It's there, but at the same time, you still need to support them through that session of their lives, that season, of their lives, because sometimes these things go away and then new behaviors come again. So it's from one thing to another. To prevent escalation, by setting gentle limits, structured. So I have some storage boxes that I've tried to put some things for her. Sometimes she uses them. Sometimes she takes all the things and puts in different things. So you just keep trying different things, because all I'm trying to say is be organized. You have to be organized. So I'm teaching her all of these skills, what she needs to do to be organized, why she doesn't need to order bottles, and then sometimes it works. Sometimes I don't see the bottles again. I see the combs. So sometimes I don't see the combs again. I see different stuff. And because she was diagnosed with autism, I began to understand why is she having some of those behaviors? And then see the thin line between autism and Down syndrome. It won't show you clearly that this is autism, but you would see some traits. So you have to be very observant so that you can know how to support your child. And then I used the special box rule just to make sure that she's not hoarding too much. And I always look for like sharp objects. Is she holding things like blade, needles, stuff like that? Because I've seen a blade before in a bag, and I'm like, wait, how did she get this? So before she starts to pick on that, we have to talk about it. We use social stories, and then I can recreate a magic box. Like, okay, this magic box can no longer keep your bottle caps. Can we use this box? So then I create a new box, put the bottle caps, and then what we do with the bottle caps is just to count 1, 2, 3. We count 1, 2, 3 with a bottle cap. We take it off the bar. We take out the bottle caps from the magic box, put it back there, just so that we eventually we are trying to redirect those behaviors. Next slide, please. So self-injurious behavior, and this may occur due to sensory overload, due to pain, or inability to communicate pain. Sometimes our children have like a high threshold for pain. Sometimes they see the needles, they don't want the needle, but sometimes they have a big injury on their finger and you may not know. They have a way they can mask the pain. Some of them don't even feel the pain. Like I said, it's quite confusing, and because they fear the needle, but when they have a big sore on the finger, like I said, you don't get to know until maybe you be like, where did you get this injury from? And when all of this is happening, I believe it's because sometimes they are hyposensitive to some of these things. And my daughter tears her skin. She loves to tear her skin. And then when we see all of those behaviors like ripping of clothes, tearing of skin, peeling of skin, and you can see the big sore and the child is not crying, what do? You have to find a way to support the child. I remember when my daughter used to do some funny stuff with her fingers, and I saw it like it was not a good thing. It's just the F word. Is connected with that. I would, in the middle of the night, I would paint her finger red like there's blood on it. That was how I was able to stop that behavior. So she would wake up crying that her finger was red, blah, blah, blah. And I was able to stop that behavior because she was already using the F word. She didn't know what it is, but people were encouraging her to do it. She was in a mainstream setting then. But unfortunately, it was just some very notorious teenagers that were doing that. Well, I had to find a way to stop that behavior. But again, when I see her peeling her skin and the skin is red, I can't even marry some of those things. So we have to identify what are the triggers, and we have to teach safe coping alternatives. Like, okay, you don't have to tear your finger. Can you tear your paper or something? So we have to always replace the behavior and then talk about the consequences of tearing your skin, peeling your skin. If you have any other behavior your child is engaging in that drives you crazy, there will always be ways to replace it. Talking about it, about the consequences of that behavior. Next slide. So these are just examples like logical consequences. So your child or your teen needs to know that if you delay in dressing, you miss the bus. I hope I'm still within time. If you throw toys, you lose play privileges. If you're shouting, you go to the calm corner. I am very big on disciplining, and although I choose my battles, I look at the environment. And next slide, please. Before I try to, react. I try not to react because that way you get more behaviors. So I put the ABC analysis. No, the right way was okay before. It was okay the other way. Yeah. So the ABC analysis is the antecedents, then we have the behavior, then we have the consequences. So I always look at what happens before a behavior. So for example, if I want her to do one or two things, and I know our usual behavior is to slam the door. My daughter is turning 15 and she's telling everybody I'm turning 15, I'm turning 15. And then, but I began to see the kind of that teenage, behavior. I began to see it when she was 11, 12. Maybe because of early puberty, early onset of puberty, I don't know. But because I know she might slam the door, and that is the behavior. The antecedents could be, for example, I say, can you wash the dishes? Can you wash your plate or wash your cup or just maybe I want to just give her a task to do. And I'm not saying it's maybe already that she wouldn't do it or I don't know if she would, but because I suspect I'm probably disturbing her at that point in time and she's going to slam the door or walk away or something like that, I just take something I know she likes away before I say, oh, can you help me do something? And if she says what she likes is nothing, maybe I've taken something away from her, she gets to do what I want her to do. And the consequence, of course, is a good one. She gets like good rewards. Oh, well done, thank you for doing that, or it was good you did that. So sometimes I don't even say good job. I don't want that because that is overly praising now, and I'm just saying, oh, that was good. It was a good thing you did that. Well done. Oh, I would just say something like washing your plate keeps it clean so that you can have food for dinner or for lunch. So that she can see that I'm washing my plate because I need to keep it clean so that I can use my plate again. And that's why, and it's not every day she washes her plate or dishes anyway. So, but I'm just trying to let you know that you must always try to, especially what happens before a behavior, the antecedents. And this is just like for data collection, what happened before the behavior, where did it happen, what's the actual task, and what was the behavior, and what was the consequences. How long did you last? I do digital detox a lot. I take away the phones, I take away the iPads a lot, a lot. And for 1 week, sometimes I take away the TV remote and I look for, and guess what? When she doesn't have the TV remote, the plate, she's busy doing other stuff, like plating her baby's hair, like coloring, like drawing. So I really, really believe digital detox works a lot. Sometimes I leave her for weeks and weeks, but when I take it, because she doesn't want to take me to take it away, I see her doing what I want to see her do more than what I don't want to see her do. If we understand this piece, you can ask questions if you don't. Next slide. I hope I'm almost through. Oh, okay. So, and what I'm trying to say today is there are so many strategies and you have to know your child. It's just like knowing your customer, what your customer wants, just knowing your child. It might be hard because your child maybe probably is not like speaking or asking for what they want, or is not able to initiate conversations, or is not able to express themselves. But guess what? Your child understands more than they can say. So looking at the strategies, you must stay consistent with routines. So in the bathroom, I've got the something stuck to the wall because at a point my daughter would just wash up and down and leave all the private parts she should wash, especially a belly button, which I realized was always like turning black, you know. But I always, because she doesn't want me to see her nakedness, I had to talk about that as well. Like, you know what, mommy is mommy, and this is mommy's body. And when mommy and Mo are in the room. Mommy is bigger. Mo is going to get bigger like mommy someday. Do you want to get bigger like mommy? She says yes. Then mommy has to help you because so those are the like parts of the strategies, and we keep it real and we are consistent with it. their routines so that your child gets used to that, because you're still going to see other challenges, other behaviors. Like, so now we're brushing our teeth morning and night. And that was because I just had an agreement with the dentist. Tell her she needs to brush in the night if she wants to grow like mommy, if she wants to grow tall, things like that. So the dentist goes and says, oh, you have to brush your teeth in the morning and night. If you want to grow tall, or do you want to grow like mommy? Do you know? So let her always be like a model, like you are the model. Their siblings are the model. Daddy is the model. Auntie is like everyone around you in the family should be able to model this good behaviors, the routines. So Big Brother recently is eating and just leaving his plate there. And guess what is happening in the house already? Mo is going around picking everybody's dishes and putting it in the kitchen. And sometimes because she knows that she is on digital detox, she washes the dishes, does everything, does some sweeping and mopping, because the phone is not with her. And she doesn't see it as being it's not punishment. I can even say you're grounded. It's okay to use the word you're grounded, because you didn't do what you were supposed to do, because you're becoming a teenager, and I'm going to get tired like trying to say do this, do that, because I'm still struggling with clean up your room, you need to sweep your room, because I know she can do it. And I have identified what she cannot do from what she won't do or doesn't want to do. I know what she cannot do. I know what she's not capable of doing, probably because she doesn't have the strength to do that yet. But she's washing up, she's doing her periods well. She's wrapping up. Any day I see she's not wrapped up a pad well, she gets the consequences. You know, I just look for, it doesn't have to be taking off the phones all the time. It might just be when she comes to talk, wants to talk to me, I don't respond to her. And she says, she knows I'm not responding. And I said to her, this is what you've done. And she says, oh, then she goes to correct the behavior. She comes back to say, I've wrapped the pad, I've thrown it, I've tied, I've done this. And that's just because I want her to self-regulate. I cannot always be with her in school or any public setting. And these are the teen years. We don't want all those behaviors all over the place. So how are we managing it from home? Reinforcing positive efforts, offer controlled choices. So I can say today, I'm not wanting you to take maybe like sugar, but I can offer you yogurt, and I can offer you what's that? I don't water. Yeah. Maybe I don't want you to have a drink. I can offer you yogurt. I can offer you water, because I know I don't even mind you taking a yogurt. I don't mind you taking a yogurt, but I don't want you to take sugar. I don't want you to take Fanta. I don't want you to take that. But guess what? What I've been seeing lately again, I'm seeing cans of Fanta, cans of in a room, in the bin, in a room, all over the place. So she has identified or developed a strategy whereby when no one is watching, she's taking Fanta where we've hid it, she's taking bread and taking to her room. So there's food in her room. If you open a drawer, she's hiding food in different parts of her room. How are we, when are we going to like recover from, get past this behavior? That's what we're currently dealing with. But I told myself I'm going to lock up the bread, which I'm doing. So I'm locking up the bread, I'm locking up and I'm saying, the doctor says you have to eat healthy, you have to, so we are still working on that. And those are strategies so that we can start to see the behavior we want to see. And when she does like takes a fruit and stuff like that, I reward it. And that's positive reinforcement, rewarding positive, the behavior you want to see. Modeling emotional regulation, I'll just talk about that, then we can go to the next slide. And that's me talking about how I feel. Like I'm modeling it to her, and I'm sad because blah, 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 blah happened. Talking with your child, I'm sad because this happened. I'm happy because this happened. Your child will be able to understand that good behavior makes everybody happy. So that's how I model emotional regulation, and then she's able to copy that. Next slide, please. Please let me know how many minutes I have left. So encouraging positive behavior, I think I've talked about this. I'm going to just slide. Yeah, so one word I wanted to say, instead of saying good job, well done, this. I would say stuff like, you waited patiently, you waited for your turn, you were good, you were good when you were good at this, you were good today. I wouldn't say good job, well done, because she has to know why I mean, good job is just too much praises. So I say, you did this. This was what you did. You were patient there. You know, you were helpful today, something like that. So and that way we're expanding our vocabulary as well. So this is like a case study. I don't know how much I have left. Sorry, can you chat to me how many minutes I have left? Okay, let me go ahead. So this is like a case study. Let me read this. A girl refuses to wash her dishes after meal, and the trigger could be she didn't want water on her hands. She's avoiding the task, or she wants to go back to play. Maybe she's on the phone or something like that. So strategy, I think I've said this before too. Before dishing a food, that dish she refused to wash, before dishing that food, talk about how you would love help because you're tired. Child needs to learn empathy, especially in difficult situations. So I'm tired, I've made food, and then you've eaten your food and dropped the plate and you didn't wash it. I might be wondering, oh, maybe she's tired today. Oh, maybe she doesn't want to touch water. Oh, it's avoidant of that. Oh, this. But what I am focusing on is the right thing to do and the behavior I want to see every time. So before I dish the food, I'll just say to her, do you know, I'm so tired. Mom is tired today. How about washing the dishes today after food or something like? So I'm already preparing her for what the behavior I want to see. Because all you can guess is just to have to drop the plate and slam the door and go away. She does that, walks away and doesn't care, But because we've talked about it, so sometimes it's good for you to talk about the behavior you want to see, like way before it happens. That way they're expecting you to like do something good too for them, just like maybe release the phone or just do something, buy them like coloring books or just something they love. Next slide, please. I should be rushing this now. I'll leave the second takeaways. Every behavior is communication. We've said that 101 million times. So consistency and empathy builds trust. So my daughter and I think my daughter trusts me a lot, and that's why I make sure I am watchful. I don't use words. I don't say what I won't do. So I mean what I say. And if I say I'm going to do it, I do it. I don't promise what I won't be able to do. And that way she knows that she's not expecting too much. So I want to under promise and over deliver, if you get what I mean. And that way she really, really trusts me. And the hard times we've had is having to tell her she has two hospital appointments that week. That means you're telling her she's not going to school. And she doesn't like it. She loves school. So I just don't talk about it because I cannot choose that battle. I can't win it. If I tell her, I might get my day ruined because she may not leave that room. She may not go to the hospital. She may just ruin my day. So I don't tell her that you're going to the hospital. I know I'm supposed to tell her, but if I tell her, she won't go. So she knows if she's being delayed, we talk about it, and she says, oh, appointment or school. And when I start saying, oh, that boil, about this, the doctor said maybe you can come. Is this something you want to? She doesn't like it. So we just keep finding a way, and I don't promise McDonald's, I don't promise TFC chicken, I don't promise meat pie, I don't promise none of that. I don't. I've got to that stage whereby I can't be using food as reward. So I just like, I just give hugs instead. I empathize with her. Then we talk about her 15th birthday, which is coming up next year. She loves, and then we talk about, okay, for your 15th. So because you must just find ways to reduce behaviors, I'm still going to share the story of how my daughter walked away from the house when she was 12 years old and got missing. Like, I don't know what I would have done. And it was that what triggered it was an hospital appointment. Imagine that she was 12 then. She just said no, walked out of the room. I didn't know she was leaving the room. I don't want to talk about it. I'm still going to share it. So I am careful to show empathy, that I wish, to the extent that sometimes in the hospital, when they're taking our blood, 6 people have to hold her down, but then I want them to take my blood. So I'm already like, can you strap this thing on me? I'm just with her. And that's empathy, because I'm preventing behaviors. That's the only thing. I'm not going to react to any behavior because I would get more behaviors. I'm just going to like talk her through this, if social stories are not working, empathy can work, trust me. And connection before correction. Yeah. And honestly, you must connect with your child. Don't just sit down giving orders or say, I've told you not to do that. I've told you not. If you do that again, no. Just say what you want your child to do. For example, I want you to do this. I want you to clean your room. I want you to take the cups. Can you please do, just that thing you want them to do. Don't use the negative. You get more behaviors. And being proactive is really, really, is truly golden for me. Like I've given an example of how proactive I can be. You know, I'm talking about, I've not even dished your food. I'm telling you that mom is tired. I would need help with the dishes. Would you be able to sweep the room tomorrow for me? Because I've got like a knee, I've got pain in my back. Because if you check it very well, your child is your caregiver, because they would love you like, because mommy needs my support at this time, I'm gonna give mommy. They would love you like no other. I wanted to say no other and I held myself, but I'm still gonna say they will love you like no other. And that is how, if you've built that relationship, and maybe you choose your battles daily, and you look at, like, in the beginning we talked about what a behavior that is like a bigger challenge, like the main cause. Then we talked about behaviors that you can just ignore, because it's not everything you shout about, but those ones that you don't want to see again. Sometimes the day they start, from the day that day they start, is when you have to stop it. You have to show surprise that, because there can be new behaviors. Like my daughter is always on YouTube now, but I'm always checking what she's watching on YouTube. She knows what she wants. Let me quickly share this. Next slide, please. So she came home one day, I was talking about sleepover. Okay, so I'm just introducing for those of you that don't know me. We run More Rainbow Down Syndrome Foundation in Lagos. So, and this is just the flyer. So I wanted to share something quickly. Oh my God, I can't, I've been having this brain fog thing. Sorry. I thought about what to share now. Honestly, I can't even remember what I was about to share. I'm so sorry. I'm so sorry. But can somebody remind me in the chat room? Maybe I'd mentioned that. So sorry. It's quite embarrassing, but honestly, it just shows you how much you put into raising a child. YouTube, thank you very much. Raising a child with a learning disability and other medical conditions, a lot of them, and you still see the child thriving. Who are you not to thrive? Well, of course, it tells on you, like literally tells on me a lot, and I just take it a day at a time. So she came home talking about sleepover, and I'm like, because she attends a special school, right? And so they have the one-on-one time with them, and I'm hearing different vocabulary every day. And she was quite ill during the week, so I was asking her, you wouldn't go to school today, but how are you feeling today? She just said, in the middle. I had never heard that like, I can hear such from adults, like when we talk, like, I'm a little bit better. So I'm like, she said in the middle, and I'm like, vocabulary is expanding. This girl is actually growing into a teenager, like a big girl, a lady. So she came home talking about sleepover, and I am not even for sleepovers. I'm not interested in sleepovers. Like, I don't even have the strength, because it means I have to go and know the parents. I have to go to their house. I have to, but of course, this girl happens to be a friend in school. And I'm like, oh, my daughter is talking about sleepover. No, how she left, that's another story, and that will be on YouTube sometime. So, because it's a story of how she got missing. Thank you very much. And the police found her. So I was talking about the sleepover thing. I don't even know. I just have this funny feeling about sleepovers. But she won't sleep over, but I could take her to visit a friend. But she kept talking about sleepover, and she came home with her daughter's address, her friend's address. And guess what? One day I saw her like during the week, she was on Google. My God, I'm having goose pimples. She was on Google. She was typing a friend's address in the space. The space. She was not on YouTube. She was on Google. She was typing a friend's address on that space where you can say anything or search whatever you're looking for. And she typed the full address and she hit search and houses came out. That particular that's a friend's address. Because her friend had written, maybe her friend's mom had written that because the woman reached out to me that, oh, that Mo, her daughter is always talking about Mo. I said, okay, Mo is always talking about your daughter. And I checked the address on the paper. I checked the address on Google. It's matched. The postcode, everything matched. And when she clicked search, I could see the girl's house. I was afraid. I started thinking about cyberbullying for our children with intellectual disabilities. I can't stop her because under 2 weeks, she was able to master how to use the mouse. All because I didn't want her seated in her room with a phone or iPad. I got a desktop. And I'm like, how will she even use the mouse? Under 1 week, she mastered it. So we cannot limit our children. You don't even know how far they can go. So we have to keep providing that opportunity, exposing them to that opportunity, and you would see how amazing. You will see amazing things they'll be able to do. And then the house popped up. I'm like, God, wow, wow, wow. They say the brain is really elastic in nature. So, um, so what I'm trying to say here is there are many ways we can reduce behaviors. If you show your child that, if you develop a relationship based on trust with your child, that might even be able to reduce a lot of behaviors. If you know there are behaviors you're worried about, you can chat in the box and we can talk about it. And I think I've come to the end of my presentation. The floor is open for anyone. You can slide through again. I think, okay, my links have been shared. Do I still have anything else? Nothing else. Okay, nothing else. Next slide. Please follow me on YouTube. And I wanted to talk to you about our upcoming webinar. Not only YouTube, all my social media handles, please, please, please. Let's do this together. Let's build a community. I want to talk about our upcoming webinar as well. We're going to be revealing the speakers during the week. This is happening on the 29th of November as well. And we are going to be sharing. I think we'll learn this way. So I'm ready to listen. We are ready to listen to anyone that has anything to say. Can they unmute themselves and maybe just contribute to what we've been talking about? Share from your experiences. Thank you, everyone. Thank you so much, everyone. Okay, who's going? You can unmute yourself. Thank you very much. Thank you, everybody.
Yeah.
Hello, Basirat.
Hi.
Are you saying something?
Is this Auntie Tola?
Yes, this is Tola. Who is this?
This Basira.
Hi, Basira.
Oh God. Thank you.
Okay.
Tough man.
Can we see you? Who?
Hi, Auntie Tola. How are you?
I'm good. How are you?
Fine, thank you. This is Sister Idaya Nike.
Oh, from Dublin.
Thank you, thank you. That was Basira. Later, take the lead,
Oh yeah,
to sign and listen. So she's very interested. Thank you so much.
thank you so much. Thank you for joining. Can we see Basira?
Yeah, and yeah.
Oh, can you tell us, Basira, tell us about yourself? It's nice to have you here.
Mm-hmm. By myself. My name is Baswa Salau. I am 27 years old.
Nice. Can we see you?
Okay,
Do you
hold
want us to?
on. Yeah, my camera's on.
For them will be done. They'll be watching us.
I work in Little headquarters in Tala, Monday and Tuesdays, and I my early start is from 11 to 4 o'clock on Monday, then Tuesday from 10 to 2 p.m.
Wow, nice to see you. Your mom has not given me your address. I need to fly to Dublin to see you, Basira.
Nice.
And I'm
That would
giving
be
you, that
that
would
would
be
be
nice.
yeah. I would love to meet you.
Oh, I'm giving you hugs now, right now. Hugs, hugs, hugs. Oh, nice to see you. This is a big surprise. Wow.
So,
So, how are you enjoying your job?
it's good. Yeah,
So, what do you do for little?
lot of things like I do some like if things like it's like going bad of a date, you put it in the sink and then new milk can go in the fridge
Wow.
like that, and then you do some pricing with all of the things that yeah. And what I do on Monday? Monday I clean, I do washing. I have to do the wash the plate and then stacking them in where the in the cupboard.
Oh my
Yeah.
God. This is inspiring. Would you like to share your story with the world? We can bring you up to be a speaker, like when we have another webinar like this.
Yeah, that would be nice. Yeah, I love that.
That's nice. That's nice. Well done. Well done. You've just made my whole year. You've made my whole year. I know your mom knows what I'm talking about.
Yeah.
And everyone here is saying, oh, nice to meet you, Basira. And thank you for sharing your story. It's really, really nice to meet you. So I'll be
Yeah.
talking to your mom about bringing you up as a speaker. Will it be something you want
Okay.
like pretty soon or much later?
Yeah. I would love that.
Oh,
Thank you.
oh, that's nice. That's nice. So that's about your work experience. What do you like to do outside work? What else do you like to do?
So outside from work, I love going out. I love going to Fee Valley town, like to do some shopping. Sometimes I go out with my family, I go out with my mom, and I go out with my best friend because I do a lot of things and stuff. And good I have good relationship with my family. I have good relationship with my mom, my sisters. I have good relationship with my best friend. Yeah, because I do lots of things outside with my mom. Even today, I'm going out with my mom today because I'm having a nice time.
Wow. Everyone, if you know you are in this meeting and you are so happy to meet Basira, I want to hear it buzz. I want to hear you send out hearts, love, everything. Just get your emojis on this. Basira, you are so, so welcome. I am so, so happy to see you, Basira. I am so happy. I'm gonna call your mom like maybe tomorrow and say a big thank you to her for bringing you on today because I wasn't expecting to see you. Everyone here is happy to see you, happy to meet you. Look at all the hearts. Everyone sending you this, Basira. Some people are actually in from Canada here, sending you love. Canada sending you love from America. The first speaker is from America. She's sending you love, I'm sure. She's got her son is 17 years old, and we have 27 years old Basira here today, inspiring us. Oh my world. I must have met your mom like about 10 years ago, but honestly, she deserves a big hug as well. As well. Do you agree with me? And Basira, how does it feel being 27?
And my mom had me for 27 years.
I know. How does it feel? Like,
Um, she, I listened to my mom. She trained me. She trained me like how to wash my hand. She trained me how to brush my teeth, and I'm getting better at it. And I'm doing everything about myself for myself. Yeah.
wow.
Yeah.
That's nice. Everyone, can you send more love to mom? Mom, I know mom is in the car there. So this time around, you're sending your emojis for mom. This is for mom. You can do it. Do it for mom. Everybody send your love to mom. Wow, this is amazing. Thank you so
Always,
much.
anytime I'm sick, you look after me.
Mhm. And do you look after mom as well? You do, of course. You're a big girl.
Mom, my mom is sick, I look after my mom. Yeah. Because me and my mom have good relationship. Because alhamdulillah.
Ah, that's so lovely. So lovely. Thank you so much, Basira. It's nice to have you here. Thank you, Mommy, for joining us today. So, do we have anyone else? And the whole chat room is filled with love emojis for Mom and Basira. Congratulations on your job. And someone is sending a message. Congratulations, my dear. You've got lots of fans here, Basira. Yes. And that's because you are doing what people think individuals with Down syndrome cannot do. You're defying all the odds. And I am so inspired, Basira. Thank you so much. Thank you, Basira. Okay, everyone, I want to say a big thank you for joining from wherever you're joining, but we are still listening. I think we've got more time. Like how much time do we have left, please?
Multinational companies.
How many minutes do we have left? Sorry.
Something that is really there sick about. And there
Please,
were years when Amazon,
please,
for
can you
example,
mute,
the company
please?
wanted me to
Uh, so, okay, the floor is open for anyone that wants to say something. It could be, do you want to share like just like 30 seconds or just you've got just one word for today. So if we don't have anybody, what how do you feel now? Okay, this is Agnes from Ghana.
Yes, this is Agnes from Ghana. How are you?
Thank you. How are you?
I'm happy to join.
Can we meet
That's
your daughter?
I'm so inspired by Basira,
Wow, thank you. She's listening to you.
and I'm looking forward that my daughter told her will grow up to be just like her.
Yes, amen. Amen.
Congratulations, mommy. I know you've done so much. You put in a lot of sacrifices for your daughter to get where she is today. And congratulations. Thank you so much. There's more we have to learn from you. Those of us who children are now, there's so much we have to learn from you. So when we host Basira, we are going to host her with you, Mom.
Yeah.
Tola, will you do that for me?
Yes, we'll do that. Most definitely. I
Thank
know, I
you.
know
Thank you.
Basira's mom likes to hide, but she's not hiding again. She's not. And thank you for all you do, Agnes, in Ghana as well. Is Toda there?
Thank you. Thank you. I'll send some information.
Yeah, and yeah.
Oh, Basira, you're still there. So people are saying well done to mom, your mom. Okay. Thank you, Mom. And I'm gonna talk to your mom later on.
Nigeria, in all over the world. Congratulations.
Okay, thank you. So
Yeah.
who's talking? So Toda Agnes,
Yeah.
is Toda there so she can say hello to everyone?
And now, no, Toda, I'm not home. Toda is not here with me.
Okay, so Toda is on
Eh,
TikTok
I
as
came
well.
I came to this funeral and I have to excuse myself to be on the on the call.
It's actually very important, and thank God you did. Thank God you did.
Yes.
Toda is on TikTok as well. I think Down Syndrome Ghana. You can follow
Yeah,
Toda.
yes, and Toda Connect on TikTok. Toda
How old
Connect.
is Toda?
Toda is 14.
14. Okay.
Yes.
That's
Hello.
fantastic. Oh, okay.
I'm excited to
Ah!
thank you. This is Pasirat's mom. 87. 87.
Hi. Nice to
Nice
see you. Please, can you
to
put the
see
spotlight
you.
on Basira's mom, please?
Hi, mom. Congratulations, mommy. Flight.
Thank you.
I want to say hello to her. Thank God. It's with the help of God. Did
Oh,
I
why
say
can't
that right? 87? Hey
Etusa.
yo, yeah. Dabena beba Ghana.
Nice to see you. You can't hide again, please. We can't hear you.
Okay. Well done. You spoke one language.
Oh, we can't hear you, ma'am. Basira's mom. What's happening?
Oh, I'm not mute. I'm not muted.
Okay, go ahead.
I don't know. We're not muted.
Yeah, go ahead. Go ahead.
I said we exchanged numbers with Auntie in Ghana and
Yeah.
across the world. Can you hear me?
Yes. Yes.
It's just the network, I guess.
That's okay. Go ahead. Go ahead.
It's the network.
Yes,
I
go
said
ahead.
we exchange contact all our friends across the world to keep in communicado, in
Yeah.
connection.
Mm-hmm.
Yeah. Yesterday regarding Down Syndrome Island as well. It was so informative, very, very informative.
Wow.
About progression in children with Down syndrome.
Yeah.
It's just like an on learning. I find it very informative. I'm going to share some information with you, Auntie Tola. Thank you
Yeah.
so much for hosting. More grace to your elbow. God bless.
Thank you. Thank you for all your positive words over the years. And I'm so happy. I didn't even know you would join, but honestly, I am so happy
Oh, if you
to
have
see you. Okay. So we'll be needing Basira back. We'll be needing Basira back to be a speaker, and you as well.
a part-time job. She's so happy that she have an income. She's always looking forward to her payday, and she does a good job. Our manager is very happy with her.
Wow. Who doesn't look forward to payday? Everyone does.
Everyone does.
That's lovely.
Thank
This
God.
is
It's just a
encouraging.
line. Keep cutting.
That's lovely. Mom, we're going to need you because we want you to share with us how you were able to do this like for 27 years. It's not a mean feat, I know. So we're going to be talking about bringing you back as a speaker, if you don't mind.
Yes.
Thank you so much.
Thank you. Thank you, Mommy.
Okay. Okay, who's going next? And we're about to round up. So I have really, really had a good day. I don't think I've wasted my time. Everybody chat in the box. How are you feeling? I am feeling 11 over 10. I remember in the beginning, I was feeling 8 over 10. So right now, Basira has made my year. Everyone that has attended to, you've made my day because we didn't have an empty room. Thank you, Elaine. Thank you, everybody. I'm feeling 101%. I am so, so, so happy, today, and I am really, really, I see, I'm already saying what I don't know. I'm just saying I'm happy. I'm feeling like 100%, like 101. Yes, yes, yes. Everybody. Okay. And this is my emoji to show how I'm feeling. I think I'm just happy. I'm feeling joyful. Okay, thank you, everybody. I'm
Thank you,
so,
Tanya.
so inspired. Thank you so much for everything. So we're going to get back to everyone on when we can get Basira back as a speaker. I remember last year we had Tolani as well. Tolani also works, and she inspired us a lot last year when we had the conference last year. So there's going to be someone with Down syndrome as well. She's going to be a speaker for the November 29th. I'm revealing that to us already. Let's see how that goes. Thank you, everybody. If there are questions, anyone want to say something, welcome that. Just have like a minute left. Is that okay? Is it okay to end the program now? Thank you, Agnes. Thank you so much for joining. Yeah, self-stimulating. So Funke is saying, very informative, especially on self-stimulating for boys. Yes, it is very, very informative. And sometimes I worry about for girls as well, like, what could they be doing? Like, because, like my daughter does not like, she likes to be alone all the time. I still have to find a way to monitor what she's doing on YouTube. And I can imagine for our older kids, like I'm looking for something to even replace that. Like all the time she's spending on YouTube. So I think I'll be learning if we can get Basira's mom, come up as a speaker. She'll be sharing some nuggets with us on how she was able to um, carry her through the teenage years. I think the teenage years, and maybe just give us insight also, because clocking 27 and being fulfilled is a big win. It's a big win, seeing your dreams, actualizing your dreams. And someone has a question. Okay. At what age can we introduce them to this? Because my son is 6 years old. Okay, Ellen, there's a question for you here.
Okay, thank you. I actually did answer it there. What we need to do is we need to introduce safe touches and understanding private versus public as early as possible, but in age-appropriate language.
Okay.
So you make sure that they know that no one must touch their private parts. You just reinforce constantly about private versus public so that it becomes almost everyday routine so that they then it's almost like uh, indoctrined in them that they know this is uh, this is my private area. I mustn't show it and no one can touch it, but always at age appropriate language, right? So you don't talk about advanced stuff that you would discuss as a teenager, but making sure that you keep them safe with the language that you use.
Thank you so much. So I've just typed there every day. Is that a good answer?
Every day, all the time, when they
So,
bath,
yeah.
whatever, you make sure. There's a lady who developed an early intervention program in South Africa, and from babies, right? And when she when she changes the baby, or she always asks for permission. Is it okay if I pick you up? Is it okay if I move you here? Is it okay? Just so that that becomes the norm rather than that people need to ask permission to touch you. And that is actually a very good a way to do it,
Yeah, that's good. That's very good. I was calling my daughter if she could come and sing this private part song. Well, of course, she's not listening. She's not answering me. So I can please just bear with me. I don't have a good voice, but there's this song that she was taught back in Nigeria. And the song goes like this: if you touch my private part, I will tell. And that's because we've taught what is private and what part is not private. So she knows the private parts. She knows even her thighs are private parts. So she says, if you touch my private part, I will tell. I will tell it to my mommy. I will tell it to my daddy. If you touch my private part, I will tell. How does that sound? I think it's a good one to start teaching. I think she started to learn about changing apart from the age of 8. I remember I'd gathered a few girls together. We had to teach them because it's better for them to be prepared than not to be prepared, because things could get messed up if they were not prepared, especially for their periods. And to know that they can't even sit on any man's laps, even a boy, even on a boy's lap, so they can like set their boundaries and know all of those things. I think for me, I think just start early. I think because we know that we're going to they might be having some challenges in some aspects of their lives, their development. So especially for children that may not have like 100% speech for communication, but then, like third party may not understand what it is they're trying to say. Especially for that, there are other ways we can teach them about their boundaries, their private parts, and just, you should know your child better. Sometimes I think parents should be the ones to tell teachers how to even teach their children, what they like and what they don't like. So that being said,
Can I say something about that?
okay.
Sorry to interrupt. So, what we often suggest regarding, you said that it's parents' job to teach the teachers absolutely about their child. What we do is, when it's the start of the school year, we send in like a one-page profile about the child to say this is what the child is good at, this is what the child is working on. So, for example, if the child has some areas that they're still working on regarding, if they get anxious and bolt, which sometimes a lot of our kids can do. They could be runners, right? Then, you could put in the profile saying, okay, well, my son is still working on self-regulation. Yes, an about me profile. So self-regulation, and could get anxious and run if they feel not comfortable in a situation. This is what we do to help to support that behavior. Just so that then the teachers are more aware of the challenges that they could be expecting and how to support the child.
Yeah. And that's also very interesting because, well, looking at that as well from what you said is part of what should have been contained in the child's like assessment, like a functional assessment. This is what a child can do. This is what the child struggles with, so that we can have like a treatment plan to support the child all through school, all through learning. Even if the child is, even if the person is of a age that can go to work or something, can work or can learn a skill or something like that. So that's very important, so that we know the likes, the dislikes. My daughter has a lot of sensory issues, but sometimes she just overcomes some of it, I think. Yeah. So initially we were struggling with brushing the teeth, her teeth and the mouth, and then she had a lot of issues with the dentition. That's quite common also with children that have Down syndrome, people that have Down syndrome, issues with their dentition. So she has like missing teeth. She has some male teeth that have not, been changed to, what's the other one? Was after milk teeth is what? Permanent teeth. So she still has a milk teeth, and of course, sometimes you find out the dentist will say they have to pull out this teeth to create space, or there's an overcrowding, there's this, there's that. So yes, we know that some of those challenges too affect speech production, especially having to use the tongue, having to use the abdominal muscles and all of that to produce speech. But at the same time, this is a child that would continue to grow, continue to learn, continue to develop, depending on the environments you put the child in. So environment plays a major factor of development. So thank you for that. Any other business? I think we were waiting for Luma to just log us out, but I think we've had a nice time today. So I want to say thank you to everyone as we leave now, as we wrap up, and have a nice holiday, come Christmas. Oh no, we're still meeting. We're still meeting on the 29th of November. So don't go yet. Don't be too far away from us. Have a lovely weekend. Have a lovely week, and have a lovely every day. And remember what you have to do every day with your child. Thank you very much. Thank you for coming. We appreciate you for taking out time, everybody. Thank you so much, Elaine, for leaving your bed too early. Yeah, to join us.
Thank you.
Thank
Bye,
you.
everyone.
Bye.